Bo. We're going to do a physical derm-oriented exam on him today. And so just like your regular physical exam, you always want to start off and repeat in a routine way. Any areas that are of concern you want to leave to the end. Let's take a look at you. We always want to include an oral check as part of our exam too, making sure there's no gingival or palate changes. We want to, of course, palpate the lymph nodes. I'm doing just a peripheral check of the ears. The pinna canals feel nice and soft. He's not painful. And then we're just going to move caudally. Using your hands and palpating is really important in addition to visualizing any changes. It's got a little bit of staining or darkening of the elbow calluses, which is not too unremarkable. You're okay. And I'm just going to pick up the paws, paying attention to looking between the toes on both sides, dorsal aspect, interdigital, palmar as well. And repeating on the other side. You're doing great. Well, let's stand up. And I'm just moving caudally, again, getting all of our peripheral lymph nodes, repeating with the plantar aspects, dorsal, interdigital. Certainly want to check the claw beds as well. Look for any abnormal architecture of the nails or the claws. Perianal area looks good. And then dorsally, I always like to pull up the skin, take a look at the hair coat. And all of this looks pretty good. Now, if you have the luxury of a table, you can certainly take a look at the ventral aspect, axillary, inguinal, and overall he looks really good under here. So we can now move forward and do our otoscopic exam. So with your ear exam, you want to go ahead and make sure that you can always have a good grip on the ear. You're dealing with cartilage, so you're able to pull the ear towards you. It shouldn't be painful. You can have your nurse or your technician assist with you. And then I'm basically just going to follow the canal. Remember, you have your vertical canal, which leads into your horizontal canal. So you want to follow through, go beyond your dorsal ridge. And because he's on a table, I can actually see straight to the tympanic membrane. And then you want to always look cranially and caudally. You can see your pars tensa, which is going to be translucent, sometimes slightly opaque, and then your pars flaccida, which is going to be soft. And then you can kind of pull out. So his are actually very clear and pretty unremarkable. I'm going to switch cones and repeat on the other side. You're doing very well, Bo. So I can see the dorsal ridge. I'm moving beyond it and down, and then following the angle, which is like a backwards L. And then I can see a little bit of ceruminous debris, but mostly I can see the eardrum again, similar to the other side. This side has a little bit more of that waxy film, but I can still see well. And overall, it looks pretty normal. Not a lot of erythema or redness.